Name is Nick Reinard. Got my hip replaced for chronic arthritis. Oregon Outpatient Surgery Center was the only place that offered a day surgery. Checked in at 6, had the surgery at 7:30, and I was in recovery by noon or so, maybe even earlier. Can't remember all that. And by 3:30, I was coming home.
You also stretch there too?
Within a week or two, I was going to rehab and starting strengthening, starting stretching, per doctor's orders. And he's basically cleared me to continue getting active as much as I can.
This represents a complete paradigm shift in the way that the healthcare industry deals with hip arthritis.
We're able to do for the patient in 8 to 12 hours what a hospital can do over 24 to 36 hours. And that eliminates risk factors such as deep venous thrombosis from sitting in bed, potential hospital-acquired infections.
Certainly, having a procedure done like this as an outpatient is not for every person that needs to have their joint replaced. There are certainly a lot of people that have enough medical conditions that make the procedure and the recovery risky enough, the potential for problems, that for their safety they couldn't be done in an ambulatory surgery setting.
The patient has to fulfill certain preoperative criteria in terms of their health record and their medical comorbidities to be considered a candidate.
Clayton's great. He's an excellent example of the person that you want to have, somebody who's motivated, healthy, ready to get up and move.
My doctor referred me to Dr. Ballard, and he said, you have a condition that we call AVN. It's avascular necrosis. It means that the blood flow to the head of the femur bone has been restricted somehow, and it's dying.
And you're just coming out.
And he said that the definitive treatment for that is a total hip joint replacement. The relief that I felt from that arthritic pain was almost instantaneous. In fact, it was such a relief that then I noticed my right hip was hurting too, and so 6 weeks later we did the whole thing again.
Yes.
In fact, I didn't want to wait the 6 weeks, but Dr. Ballard said, yes, you have to wait 6 weeks in between. He said, you have to have that time to recover, gain some strength. So I said, oh, okay, I'll wait.
The wonderful part of this procedure is it is designed and it's intended to give that life back to a patient.
This represents sort of a natural evolution in joint replacement and really in medicine in general. And I think we're going to be leading the way, but others will follow shortly.
It's amazing to people that I had this hip replaced in one day, and it really was amazing. And in the morning, check in, get prepped, have the surgery, a few hours in the recovery room, go home.